Today I want to talk about SBAR. SBAR, it's a form of communication when you're calling a doctor for a change in your patient status or you are giving hand of shift report. It's a more organized way to provide report in a timely manner. A lot of my nursing students struggle with this. You have to practice in order to get better at it. But I'll go through it in a simple way. Okay? SBAR, S stands for situation, meaning there is a change in your patient's status, something that wasn't there before that is new. As an example, you're calling Dr. Smith. Good afternoon, Dr. Smith. My name is Rose. I'm a nurse on 2 West, and my patient JS in room 101 is complaining of new onset of chest pain and shortness of breath. Okay? Now, for background, you want to give a little more detail on what led to the chest pain or any important surgical or medical history. Okay? The patient has a prior history of myocardial infarction and also had a cardiac stent placed 2 years ago. He is also has a history of hypertension, hyperlipidemia, and a non-compliant diabetic. His surgical history includes the cardiac stent and also right knee replacement. That's that. Okay, now your assessment. That includes what the patient is reporting to you, including your own assessment, right? The patient is complaining of a pain of 10 on a 0 to 10 scale. He appears to be restless and unable to take deep breath. Lung assessments were clear. However, the patient described his pain as crushing, and it's on the left side, second intercostal space on the pulmonic area. He denied any nausea, vomiting at this time. Okay, so now we've done the assessment. You want to talk about your recommendation. Is what you want to be done to make sure your patient stays safe and stable. Okay, given the patient history of prior myocardial infarction and stent placement, I already placed him on a 2 liters of oxygen for comfort. But I'm requesting that you order an ECG or EKG and blood work, but also to have one of your attendant, or if you can come down and evaluate the patient as soon as possible. I'm afraid he's having another cardiac event, and I will continue to monitor his progress in the meanwhile. So that's that.